Today I want to talk to you about our neuropathy program. We treat nerve injuries, whether it's from chemotherapy, diabetes, diabetic polyneuropathy. Spinal degeneration is probably the largest population that we see with neuropathy. And there's other causes of neuropathy also. There's many medications that cause neuropathy. And neuropathy is nerve damage. So if the nerve is not working properly, it doesn't do its function. It can't get information from the brain to the rest of the body properly. And we start to see things like numbness, tingling, pain. A lot of people complain of burning pain or squeezing pressure. Swelling is another common symptom of neuropathy. And it's progressive, and it usually gets worse. When it gets bad enough, it starts to affect the balance. And balance and stability is a very common problem in the older population. In fact, head injuries is the #1 cause of death in the older population. So this is very serious. So we have many different types of treatment in our program. One, of course, if it's due to spinal degeneration, if neuropathy or nerve damage is due to a disc that's pressing on the nerve, or the spine that's compressed around the structures of the joints of the spine, we utilize spinal decompression therapy. We do it anyways in our disc program. So if you have a herniated disc, a bulging disc, it's much like a jelly donut that's being squished. And that part of the disc can actually end up compromising the nerve. In the neuropathy program, there's many things that we do. But today I want to talk to you about the Hakamed therapy. It's electroanalgesic medicine or electromedicine. And there's many different things that the Hakamed does. Hakamed achieves high frequencies that are able to stimulate the nerves. So our nerves fire at different frequencies. And unfortunately, many of the conventional TENS units, electrical stim units that you see in a lot of chiropractic and physical therapy centers and practices, they don't get to that high enough frequency in order to stimulate the nerves the way that is needed in order to cause what's called neuroplasticity. So neuroplasticity is where the nerves actually heal. And that's what Hakamed therapy does. We are able to achieve frequencies up to 20,000 hertz versus a regular TENS unit, which can get up to maybe 150 hertz, or an EMS unit up to about 150 or 200 hertz. This goes up to 20,000 hertz. Where we stay anywhere between 4 and 12,000 hertz because we know the nerves fire at that level. We can also use this therapy as a pain management tool, which is very effective. And by the way, this isn't just short-term relief. This gives long-term relief and lasting relief. One of the reasons why Hakamed is so effective at managing pain is because we're able to clean up chemicals like CAMP. Cyclic adenosine monophosphate is a chemical that produces pain. So these frequencies help destroy those chemicals. These frequencies help destroy inflammatory chemicals, inflammatory factors, so people can get symptomatic relief very quickly. There's another significant advantage with the Hakamed therapy. And by the way, we do laser therapy, spinal decompression, Hakamed. We have equipment that goes home with our patients for them to do as homework on a regular basis. Nutrition is very important. Adjusting is very important. High-level rehabilitation is very important. But the Hakamed is one of the things that is able, or we're able to use to get our patients symptomatic relief very quickly. One of the main reasons we use it is because it achieves what's called neuroplasticity, or where the nerve can heal. So between 4,000 and 12,000 hertz, those nerves are stimulated to the point where we can actually create a chemical and electrical change. So what's different about the Hakamed therapy, in fact, it's the only unit that causes a horizontal frequency modulation. They have the patent on this technology. It's the only unit that can do this. And when you can stimulate the nerves at that level, you're creating a biochemical and bioelectrical change in the nerve at the same time. And that's why the nerves actually heal. There's nothing in medicine, medicine is great for so many things, and we need medication for certain things, life-saving things. But as far as neuropathy goes, neuropathy is a progressive problem, progressive disease and condition. Medicine can't change it, surgery can't change it, exercise can't do it. An adjustment alone is not going to, I've never seen a chiropractic adjustment being able to manage and treat neuropathy where it actually reverses. It's an intricate part of the program, but there's more that needs to be done. And that's the benefit of this. So I'd like to show you around the clinic a little bit. This is actually where we do our consultations right here. We're able to put up the imaging, the MRIs, the x-rays up on the screen for the patients. And let's take a walk down the hall. Everybody's gone for the day. It's Christmas Eve and patients are all gone, and we're going to be going home shortly. This is the room where we do our x-rays. We do digital x-ray in here. And if a patient does not come in with x-rays, we need to see exactly what's going on. We'll light them up and figure out if we can help them. This is one of the treatment rooms in here. And then we're going to walk down the clinic and we'll come to the room where we do the Hakamed and laser. This is our decompression room. Okay, spinal decompression. This is the Hakamed and laser room. So right in here you can see all the chairs that we have lined up. These machines are running every hour on the hour for our patients. This is the actual Hakamed machine here. We have 2 of them because very quickly we got maxed out because people get results. You know, when you can manage someone's pain, decrease inflammation, stimulate the nervous system to the point where they feel better, they talk about it. So this is the chairs, and these are very comfy chairs, by the way. And then I'll take you up to the front where I can show you the therapy room too. I'm going to walk on up to the front and get to say hello to Juliana, who's still here. Say hi, Juliana.
Hi.
Getting ready to go home for Christmas. This is where we do whole body vibration and some other therapies. We have therapists that work with our patients, spinalator, and the jet itself.